Now we're going to talk about disposable matrices. These are going to be used when we're working on either doing buildups or working on pediatric teeth. So we have two different kinds. We've got the orange one and we've got the purple one. We always remember that purple is pedo. So we're working on a pediatric tooth where the interpossible contact isn't as critical because it's probably going to be lost and within a short period of time anyways, and putting pressure on like a kiddo's teeth and wedging it and all that is not a lot of fun for them. So if we need to, we will just use this purple pedo disposable matrix instead. But the one we use when we're doing buildups is going to be this orange one. And so how do you tell how we're going to put this on? First of all, a neat feature about this product is that you can bend it this way or you can bend it back the other way. And you'll need to know what side goes in. Like for example, does this go in like this? Or if I flip it around, does it go in like that? If you look at the shape of this, there's a part that kind of bows outward a little bit. Let's see if I get this on the camera. Right there, you can maybe see that this comes out a little bit further, and this is kind of tighter, tucked in towards the actual device itself. The shorter part, this goes down underneath the gums, or slides in first. So if I'm going to be working on, say, this MOD, I'm going to do a build-up before I do a crown prep. Then how I would put this in is, again, I would have this part needs to go toward the gum line. Put this over here, and I would swing it this way. So now it's in, or I mean, now it's positioned the right way. Let's go ahead and slide it in place. And these are a little tricky, especially if the tooth has got multiple areas that you kind of have to get around. You'd have to try to work on one area, and then as soon as you get to another, sometimes it gets hung up. So these can be a little bit tricky, but you can take your finger and deform this slightly just so you can kind of get it in those little weird spots. So once you get it in, of course, make sure it's just like the sectional matrix. It has to slide down underneath the actual prep to rest just underneath the gum line. And as you're tightening this, you got to hold it in place. So many times we'll just hold it right over the tooth as we twist this locking mechanism. Now, you want to make this nice and snug, but you don't want to get it too tight. Because if you go too tight, it's going to snap and break, and then you'll have to take it out and grab another one. But this is that's about tight enough right there. And so you can take a look when it's in place. It's perfectly covering around that tooth, and it's great for when we don't really care much about getting a contact, but we just still need to control where the composite flows to when we're packing it in place. And if sometimes there's a gap, we may put a wooden point in place, which, by the way, I'll kind of go over quickly some points. In the office, we have different points or different wedges. We have this one wedge used primarily, and then we have these little wooden ones that come in various widths, thicknesses in order to close up a space that's in there tighter. Or we have these plastic ones. These plastic ones are kind of a neat design that you can take them and you can either break them right off or you can bend them. And now, when they're bent like this, you can go straight in and wedge it in place and leave it in place. Remember, the patient's cheek would be right here. So these are kind of handy to put on. Or once you get it in, you can always just twist. Oops, that's not working right. Put it in there, and then you can break it off. But most of the time, you just actually leave it in there, and then when you're finished, you just slide it out, so you don't have to use a cotton forceps to do that. So yeah, you put that in, and then you go through our normal bonding steps. At this point, I'd like to show kind of an interesting device that we use at times. This is called a contact former. I know I just said that this matrix isn't that important when we're trying to get a contact. This will be used mostly for an interproximal sectional matrix. But what this does, if the doctor sees it, even after putting in this, some kind of matrix system, and even after they put in the bitine rings and everything's being pressed in the right spot, but there's still a little bit of an open space the doctor can see between this actual matrix and the tooth next to it, they can actually push. Let's see if I got this oriented right. Okay, this is the distal. You'd actually take and put this in, and the doctor will push distally, and while he or she is doing that, the assistant would come along and right on this top platform would take the curing light, rest it right on there, and while the doctor is applying pressure, activate the curing light, and it will cure the composite right through the platform down to the tip, and will get the composite beyond this tip set. And what we do in our office is after we get done doing that, we take this away and then go right in with the curing light and cure this just to make sure that the light truly got down inside that box. And then after that point, we keep building the tooth up, and this little device really does help in creating some contacts when it's a little bit shy of where we need to go. And like I pointed out earlier, it does have a label here, mesial and of course distal. So it's just the way that's shaped. The doctor can put this in, push distally, or if they're on the mesial, they can take and pull mesially, and it will achieve that extra little bit that we need. Okay, so now that we are done with this procedure, we would then of course take out the wedge or the point, back this off just a little bit just to loosen it, and then we would just wiggle it off. And just like in the sectional matrix, we do a finger or a wrist motion. We don't do an elbow motion. We don't jerk this out of the mouth. Again, sharp edges can cut lips and tongues and other things that don't need to be cut. So be careful when working with these. As with any sharp object in the mouth, just have a controlled motion when you're trying to remove it. Okay, great, thanks.